Hi, my name is Dr. Elizabeth Zerbinski and I'm a chiropractor in North York. Today I'll be talking to you about back pain during pregnancy and how chiropractic care can help. In a related video, I will be discussing Webster's technique, which is a special chiropractic technique that is used to address the alignment and function of the pelvis. So, I hope you enjoyed this short video. Let me start off by saying it is extremely common for women to experience back pain during pregnancy, especially the low back and posterior pelvis. Why is that? Well, there are some profound changes that occur to the woman's body during pregnancy, and I will be discussing some of those with you right now. So, for example, some common changes are weight gain, fluid retention, changes to posture, changes to the way she walks, and hormonal changes. So, weight gain makes sense. The average woman will gain between 25 and 35 pounds during pregnancy. So what that means is that there's more force and pressure going through the joints of her body. And in addition to that, her muscles have to work harder to carry the extra load. So that makes sense that it can lead to irritation to the joints as well as to the muscles. What about fluid retention? In fluid retention, basically the body is retaining fluid. So that can lead to puffiness, to swelling, and ultimately that can lead to less space for where the nerves are traveling. A nerve can ultimately be pinched. So when a nerve is being pinched, it can lead to symptoms such as pain, numbness, tingling, for example. An example of a nerve compression disorder is carpal tunnel syndrome. So in that scenario, the median nerve is being compressed within the wrist, and that leads to numbness and tingling in the fingers. A similar situation can happen in the foot, and that's known as tarsal tunnel syndrome. Another example is what is known as meralgia paresthetica, which is compression of the lateral femoral cutaneous nerve, and that leads to symptoms like numbness and tingling in the outer aspect of the thighs. So depending on what type of nerve is being involved, the symptoms will be in a different area. Now, what about changes to posture? Some common posture changes during pregnancy are forward tilting of the pelvis and also accentuation of the curve of the low back. So what results because of that is that the joint surfaces in the low back are being compressed closer together. So that can lead to irritation of the facet joints of the low back or the sacroiliac joints. So in addition to that, the muscles of the low back are working harder to counterbalance a belly that is growing forward. So it's counterbalancing the weight, the muscles tense up, and that can result in irritation to the joints and irritation or achiness in the muscles. So those are posture changes. What about changes to walking? Especially during the third trimester, women tend to walk a little differently. What happens is they tend to adopt a wider base of stance, and so when they walk, their feet are farther apart from each other, sideways. So the reason for that is because it's a more stable position for her body to be in, but as a result, the muscles of the lower extremity are being challenged differently. And in addition to that, the alignment of the joints of the lower extremity, including the ankles, knees, hips, sacroiliac joints, it's going to be altered. So everything is functionally connected, so that can in turn lead to irritation to joints and irritation to muscles as well, which makes sense. Lastly, hormonal effects. There's a hormone that is released by the body called relaxin during pregnancy, and like the name suggests, relaxin is responsible for softening and relaxing the connective tissues of the body. So the reason for it is because it's preparing the woman's body for eventual delivery. It's where everything has to open up. So that in itself can lead to irritation to joints because there tends to be more motion that occurs, as well as irritation to muscles, ligaments, etc. So that's that. So now you understand why there is pain during pregnancy. There are some profound changes that occur to her posture, to the way she walks, to her hormones, and everything. Everything combined leads to that achy feeling. But what can be done about it? I know that most women during pregnancy, it's a very special time. They're looking for very safe therapies, therapies that are drugless, non-invasive, safe, gentle, effective. And the good thing about chiropractic is that it offers just that. Chiropractic care is a hands-on form of care, and it's safe and effective, gentle, completely drug-free. The whole goal of chiropractic care is to improve the mechanical balance in the body, so improving posture and alignment of the joints, and by doing so it helps to relieve that irritation to the muscles or to the joints. In addition to this, chiropractic care helps to facilitate optimal communication with the nervous system. So these are all positive changes that can result from chiropractic care. Chiropractic care is very gentle, especially in pregnant women. Oftentimes less is more, and the techniques are very effective as well. Now, what is the process? The first step is a discussion with your chiropractor so that they can understand more about you, more about your concerns, about your health history, and about your pregnancy so far. Thus, to better understand your whole picture of your health. The next step is to undergo a physical examination. The chiropractor will assess your posture, your alignment, your ranges of motions. We'll do some neurological testing, some orthopedic testing, and this is all to better understand your body and to identify those problem areas and establish a diagnosis. So after the physical examination, the chiropractor will discuss their findings with you so that you can better understand the why and the how. So if you're looking for a chiropractor in your area, what you can do is go to the ICPA4kids.org website, and you can input your postal code, and you'll find a chiropractor who has special interests in treating pregnant women. So you can do that. Or if you're in the North York area, you're welcome to book an appointment at my office. I'd be happy to help you as well. I hope you enjoyed this short video and found it informative and interesting.